Hello, my name is Melissa Daniels, and this is Strabismus to Stereopsis, a channel all about strabismus and lazy eye and all the eye issues that come with that and how to solve them, how to overcome that. That is what I am trying to put out into this world, is to help people who have strabismus. So if you haven't checked it out yet, make sure to go over to learn.strabismussolutions.com. That's where you can get a lot of the different free resources that can help you get started on your own journey so that you can get your eyes from being, let's just say, misbehaving to doing a little bit better. My eyes aren't perfect, but they're a lot better than they were. Right now, I am doing a series, a Q&A series, where you can submit any question that you would like answered in video format. And if it's a question I don't have a specific video about, I will make a video about it and answer your question specifically for you. So today's video is going to be all about adult onset strabismus and risk factors for surgery, and when to know when should I get surgery, when don't I get surgery, all of those things. Again, I'm not a doctor, so this is just my personal opinion. Always see a doctor about anything with strabismus, honestly. But if you have other questions that you'd like me to answer, make sure to put it in the comments. You can send me an email at melissa@strabismussolutions.com, contact me on Instagram or wherever you like to contact me. So let's get on with our question. This question is from @rawstmv. Don't know what that is. The YouTube handles are always really interesting. Okay, so this person said, how to know when and if you should try surgery and the risk factors for adult onset. Just some background. No other medical issues caused my strabismus. It was a bad prescription and bad visual habits. I know it's a question best left for medical professionals, yes, but I have gotten a lot yes and no from them and feel petrified by the fear of making it worse. The whole situation has destroyed my mental health. Yes, that is so hard, having different opinions from different people. And so here comes another opinion, and fortunately I am not one that's gone to school for 7 to 10 years learning all about strabismus. So it's just the patient perspective and what I've seen from talking to a lot of people. So first of all, I have addressed when to have surgery for different types of strabismus, and so you can go back and check out those videos. But I will speak specifically to people who have adult onset strabismus, because that is a totally different beast than those of us who were born with strabismus and had surgeries and patched and wore glasses as little kids, and maybe it corrected a little bit and then it came back as an adult, right? We are a very different situation than somebody who grew up with straight eyes and then all of a sudden as an adult something happened and the eye all of a sudden goes out or all of a sudden goes in. So it is different. Let's dive in. Usually for adult onset strabismus, there are certain places where you can use your eyes together and get fusion and have alignment. So a lot of times at near, especially for somebody who works a ton at a computer, they work near, and they can get single vision, and then they look in the distance and all of a sudden they're seeing double, or they're getting an eye turn. Other time it could be opposite. Sometimes people will get this like after a traumatic brain injury, something will happen. A lot of times there was actually an underlying vision issue that was there earlier throughout childhood, but they didn't notice it. Maybe convergence insufficiency. So the eyes were aligned, maybe just not coordinating very well together. And so that can decompensate, especially after a stroke, a traumatic brain injury, being old, right? Like being on a computer all the time, bad visual habits, a bad prescription, right? All these things can kind of like decompensate maybe a smaller problem that was already there and like make it way worse. So as a general rule, I don't recommend surgery for people who have adult onset, because unless it was like a muscle got ripped or torn or something happened in an actual like traumatic event, usually it is related to habits, right? Maybe looking too close, or, just something has decompensated. And so it's already like that ability to use the eyes together and get fusion is already in there. And so like you just have to like reawaken that and work on getting it more efficient. So I would almost always, like 99% of the time, say do at least 1 year of vision therapy before having surgery, because this is, you're saying this like bad habits. So I think of it like if someone were to go get what's the thing where you like staple your stomach, right? You're overweight, get your stomach stapled, and then you're going to like lose all this weight. But you do that and it might work for a while, but if you just go back to eating the same things and not being active, you're going to go back to how you were before, right? And so that can happen too. Like you have the strabismus surgery, they help, your eyes turned in, they help align your eyes, but then you go back to just really bad visual habits and it could just as easily go back in again, right? Because you still have those like coordination issues with your eyes and bad visual habits. And so going to vision therapy can help you get rid of those bad visual habits, learn how to take care of your eyes in a way that they are going to be able to maintain straight position. Most of the time, I would say people that go to vision therapy who have this adult onset are able to have success within a year, right? That's a lot of times they'll have success earlier than that. Sometimes it takes a little bit longer, but usually within a year, you kind of know if it's going to work or not. Once you've done the vision therapy and you know how to handle your vision and take care of your eyes, and you're still just stuck at a certain level where it's like, okay, past 3 feet, it's just double. And I have this eye turn and I just can't control it, right? If there's something like that and it just isn't budging, I am not against surgery. I am maybe the only person in the vision therapy world that feels that way. I'm definitely more pro surgery than others. But I have seen people who have that issue and they go get a little tweak. This is not going to be like the same kind of surgery that I had where it's like revamping my whole eyes and cutting and pasting every single eye muscle that I have. Probably would be more of a tweak to help with the distance, help with some double vision. That can make a really big difference sometimes. I would never start there, right? Because that's like not changing your eating habits and then getting a stomach surgery, right? You want to make sure you change the habits and then get the surgery. And that way those results can last and you will know how to use your visual system in an efficient way that you don't have to compensate for anything. And it can really help and even speed up the process. Maybe, someone commented on that person's that, they've been in vision therapy for years and years. And it's like, they've been told surgery is never an option. And that's not true. Like it's more risky. And that goes into the next part. What are the risk factors for strabismus surgery? I would say the biggest risk factors is that it just doesn't work. Like that your eye stays the way it was or it goes the opposite direction. So if it's in, it could go out. If it's out, it could go in. For somebody who, if you already have double vision and the eye gets moved, there's no guarantee that that's going to fix the double vision, and it could give you a different type of double vision that is more difficult for you to cope with. So maybe somebody has like an up and down double vision and we call it vertical here. And they're like, oh, I just can't, they're kind of used to it. And then they go get the surgery and then something happens and then they start getting a horizontal or vice versa. And it's like, they just can't stand it, right? So there is that risk. I don't know the numbers. This is where you'd have to talk to the surgeon based on your exact case that, is that possible? Is it not possible? If it's a minor surgery, where they're just adjusting one muscle, to me, like I've seen and talked to so many, like hundreds of people who've had strabismus surgery, and I've never seen anybody go blind. I've never seen anybody like with these horrible problems like that you're probably thinking of, right? The things that I was like, oh my gosh, I can't get this surgery because what if like my eyeball pops out and I don't have a second eye, or like just ridiculous things, right? None of that's going to happen. But like the biggest risk is it just doesn't work. So you go through that, you spend the money, you spend the time, you deal with the redness, the itchiness, the pain, the like anxiety of the whole thing, and then it doesn't change anything. And to me, like that's kind of a big risk. Like you have to be willing to like jump in with both feet to something you aren't sure is going to work, because it might not. And so to me that is really the risk factor that I would think about and go into surgery. Like, am I willing to accept that risk? Am I willing to accept that? And am I going to just like, okay, this might work and it might not. And I'm okay with that. I'm in either way because I want to know if this is the thing. And if it's not, that's okay. Like we'll try something else. But that is, I think, the risk that most people don't focus on. They're more worried about things that like are really, really, you know, like 1% of people or 0.5% of people experience instead of the thing that, you know, 30 to 40 or 50% of people experience. So long story short, do vision therapy for at least a year. If you're not seeing any results, the eye turn hasn't changed at all, you haven't improved like your fusion range, I would totally consider surgery. If it were me, I would totally do it. I don't know. To me, I'm willing to risk it just to see, like, okay, I tried this professional for a year. It seemed right. It seemed like the best way to go, but it's not quite working. Let's see if this other guy can help it move along a little quicker. I'm kind of impatient. I'm a little bit like, well, we'll see what happens. And so that's what I would do, but I'm not a doctor. I'm definitely not your doctor. And so it can depend on the person for sure. So good luck. I hope it all goes well and you get it all figured out. And if you have questions and you're watching this video, you can put them in the comments and I will see you in the next video.